The bitterness of treatment in the bitter medicine. There has long been a profound connection between art and medicine, with each reflecting the complexities of the human condition in its own unique ways. While medicine seeks to alleviate suffering and restore health, art captures the emotional landscapes of those enduring pain and uncertainty. The masterpiece by Flemish artist Adriaen Brouwer, titled The Bitter Medicine, serves as a striking visual narrative that reveals the intricate dynamics of suffering and healing. Through his masterful depiction of raw human emotions, Brouwer invites viewers to empathize with the often unsettling realities faced by patients grappling with their illnesses. This provocative and humorous work, painted in 1637, portrays a young man holding a bottle of unpleasant medicine, his face contorted in disgust. This visceral expression conveys the emotional turmoil that often accompanies medical treatment, embodying the harrowing realities of chronic illnesses through artistic representation. Adriaen Brouwer, a pioneering artist in the genre of trony, transcends individual narratives with his focus on character studies and universal emotions, delving deep into the essence of human feelings. His work The Bitter Medicine, through its exaggerated and intertwined facial expressions of the young man, encapsulates a profound struggle that evokes empathy from viewers who can resonate with the discomfort and fear often associated with medical interventions. The strong brushwork and dynamic composition draw the audience into this challenging moment, inviting them to reflect on their own experiences with illness and treatment. At first glance, The Bitter Medicine may seem like a mere depiction of a young man facing an unpleasant experience. However, upon closer inspection, one can observe more complex layers of meaning that represent the harsh realities faced by patients, especially those contending with chronic or terminal conditions. The bitter taste of medicine acts as a metaphor for these realities, illustrating how the prospect of treatment can be fraught with anxiety and resistance. For many, even the thought of confronting an illness stirs feelings of fear and helplessness. Medicines, particularly syrups, can evoke tastes that are bitter, metallic, or even sour in the mouth. These flavors typically arise from the chemical structure of the drugs, which can turn the experience of taking medication into a genuine challenge. Interestingly, in some cases, unpleasant tastes are deliberately designed to prevent misuse or unauthorized consumption of drugs. This measure not only helps limit drug intake, but also reflects broader concerns regarding public health. Brouwer skillfully captures this sense of disgust and reluctance in his work. The contorted and repulsed face of the young man does not merely express hatred, it represents the inner conflict many individuals experience when faced with terminal diagnosis. The bitterness of medicine reflects the emotional weight borne by patients. It unveils fears of side effects, uncertainties about treatment outcomes, and the acknowledgement of pains that may never fully subside. This bitterness extends beyond the taste of medications. It permeates the overall experience of patients undergoing treatment. Patients confront emotions such as despair and fear that may be even more bitter than the unpleasant taste of medicine itself. In this context, Brouwer invites us to not only consider the physical aspects of treatment, but also to delve into its emotional dimensions. As the audience engages with the bitter medicine, they feel compelled to acknowledge the vital role of healthcare providers in addressing these emotional challenges. Physicians and caregivers must not only consider the clinical aspects of treatment, but also examine the psychological barriers that patients create in response to their fears. The act of taking medicine transcends mere physical effort. It transforms into a deeply personal journey measured by vulnerability and resilience. Brouwer's work serves as a powerful reminder that true healing extends beyond mere medical interventions. It requires an empathetic approach that validates patients' fears and uncertainties, while creating a space where they feel supported. Understanding the emotional landscape of individuals facing chronic illnesses is essential for healthcare professionals seeking to guide their patients through the complexities of treatment. Adriaen Brouwer's The Bitter Medicine, beyond its visual appeal, offers profound insights into the intricate relationship between art, medicine, and the human experience. Through his masterful portrayal of emotions, Brouwer captures the essence of a patient's reluctance and avoidance when confronted with the harsh realities of medicine. This artwork invites us to reflect on the notion that treatment is not limited to alleviating physical symptoms. It encompasses a holistic understanding of fear, uncertainty, and acceptance. Ultimately, Brouwer's legacy endures, inviting everyone to participate in a compassionate dialogue about the shared experiences of patients navigating their journeys through pain and recovery. This conversation ultimately creates a meaningful bridge between the worlds of art and medicine, highlighting the importance of empathy and deep understanding in the healing process. Thus, The Bitter Medicine is not just a work of art, it is an invitation to engage in profound contemplation about the human challenges we face on the path to health and healing.